questions that I get asked the most, actually, is what issues do I deal with? And it's an interesting question, because people tend to assume that I do the smoking cessation and what is on an average kind of hypnotherapy experience. And I would say probably about 98% of my work is not average. Is probably amongst the more complex issues, which I love. I love to help people working through something that potentially is not the normal thing you would go and see a hypnotherapist for. However, the reason why it's so useful to come and see a hypnotherapist is because it's to do with you and your mind. There is only that. So if it's something to do with the mind, there is no other choice but to work through your attitude, your abilities, your experiences through the mind, through your imagination, through your will, through your won't. Any issue that you have belongs to you, which belongs to your mind. And I think that's why I love doing the really complicated issues. And I mean, one of the things that most people know me for is medical and dental and working with kids. And they're pretty complicated. You know, people have often said to me, Sharon, you know, the kids, that must be brilliant, so easy. It's definitely not the easy ones. The children are often the hardest to work with. Not because they're difficult as people, just because some of them don't actually even understand what they need to create as an outcome. They're in the present. So they're not looking to the future to know, this is why I need to go and see Sharon. They kind of land up and think, well, I'm just in the present. I've got an issue right now, and there is no, that's the way it is. And it's not being stubborn or annoying or awful or naughty. It's just they're in the present. So working with somebody who doesn't have a need to look at the future and say, well, actually we need to get to this outcome, that's actually quite complicated to convince somebody. And especially somebody maybe 5, 6 years old, 4, 5, 6 years old. Or especially somebody who has maybe special needs. Especially somebody who has Parkinson's, Alzheimer's, people with cancer who aren't necessarily connected to the future in some way because they're at certain levels down the road, but they really want to deal with the present. It's an interesting concept, actually, what happens to the mind at that point and how to help somebody through it. So in a sense, you know, working with people who've got issues that are a little bit more off the wall or sideways, where they don't want to go into long-term therapy, they just want to sort out the now. But they know that there is actually a long-term issue there, or a potential long-term issue, or it's already a chronic issue. They're quite complicated, but I find them most rewarding, and the patients or clients have incredible results and eye-opening, heart-opening experiences about themselves and their abilities. It's really wonderful.